March is Colon Cancer Awareness Month. The American Cancer Society estimates that about 140,000 people are affected by the cancer each year, and about 50,000 of those people will die. Joining us this morning is Dr. Stephen Deutsch with IU Health to tell us more about the cancer and how to prevent yourself from getting it. Thank you so much for joining us this morning.
My pleasure.
So let's start out just talking a little bit about the Awareness Month and kind of what goes on during Awareness Month.
It's critically important that people be aware of colorectal cancer, also known as colon cancer. It's very common. It's important to be screened for that disease because it's so preventable. Awareness Month is just to bring it to the attention of people. More and more people have become aware of this disease over the last decade in particular, but a third of our population is still not screened for this disease. So it's important to get the message out to people that they must come for their screening colonoscopy as a way to prevent this disease.
And let's talk a little bit about symptoms. What are some symptoms or signs that one might feel or see if they are experiencing colon cancer?
Far and away, the most common symptom of colon cancer is that you have no symptoms at all. You need to be screened at age 50 for the majority of people because the disease is known as a silent killer. It often begins as the growth of a polyp, a growth within the colon that grows over a period of 10 years generally before it becomes cancer. In those early stages, you may have no symptoms. So the only way to know is to be screened and have a colonoscopy. Other symptoms are rectal bleeding, which is very common. The more common cause is hemorrhoids in colon cancer. People shouldn't be afraid to see their doctor because of that symptom, but that can be a sign of colon cancer. A change in bowel habits, diarrhea, constipation, alternating diarrhea and constipation, thin bowel movements, flat ribbon-like bowel movements, abdominal pain. When you have loss of appetite and weight loss, the disease is further along. It's important to be screened early.
And IU is partnering with Purdue for some research. Talk a little bit about that.
We are very committed at IU Health Arnett to impact clinically our patient population in our communities. So we're doing that clinically through screening colonoscopy, but also we are intellectually stimulated to try to solve this problem of colon cancer. And we at IU Health Arnett are partnered with Purdue. I'm a co-principal investigator in a study with Dr. Marietta Harrison, a fabulous lady researcher at Purdue with a huge team there in conjunction with our surgeons, our primary care physicians, and our gastroenterologists at IU. To study colon cancer. We're collecting polyps from patients, we're collecting colon cancer tissue, and we're doing blood work to try to find biomarkers to help solve the etiology, the cause of colon cancer.
All right, Dr. Deutsch with IU Health, thank you so much for joining us this morning.
My pleasure.
My pleasure, too.
Thank you.